He's a very impressive man and doctor, leader within his community. And so I wanted to again introduce Dr. Richard Clement to all of you. So
thank you.
Thank you.
Yes, many years ago I was lecturing in Canada, and there was a very strange doctor with piercing eyes and a good energy who came and we had a talk, and his name was Paul Drouin. And since the years we kept in communications, and I must congratulate him for what he's done, his achievement, and creating that school and that knowledge. So we'll speak about genetic testing, and we're going to put some disclaimers because we live in America. So I'm not employed by the company. I am just an associate because along the years I've been looking for partnerships with people which are advanced in their field, technologies, products, because sometimes people says, what is your specialty? And with humility, I would like to say, my specialty is results. Because we all aimed at finding results, and we cannot only give to our patients what we know, but sometimes we have to look otherwise to find out new solutions. What we're going to be discussing is wellness testing, because we have the opportunity that the FDA has opened the direct consumers analysis of genetics. So you are able to provide that services to your patient as far as you're not talking about diseases, as far as you're talking about wellness. I've been in practice for many years. I started my practice in France, then I moved to the West Indies. And I realized that medicine is very different because I had three types of patients. I had the French patient who says, give me some medications, but whatever you give me, I want it to be reimbursed by the Social Security. We had the American patient who says, let me check with my doctor in New York first before I take any of your medication. And I had the West Indian patients who were telling me, doctor, you're fantastic, I'm feeling very good. And I says, did you take your medication? He says, no, I never took it. So I realized that, patients have different belief systems, and during the workshops, we're going to also be able to challenge your belief system because we will be applying genetics to nutrition, and in the workshops, we're going to try to find out what you believe in, what you use, what makes sense, what does not make sense. Because one thing is sure, is good science is good marketing. So you need to empower yourself with knowledge to be able to deliver that message. I did also a nutritional line because I believe nutrition is very important. So I made a small nutritional line. And about 9 years ago, I shifted my interest. I still have the lines of homeopathy and nutrition, but I shifted to medical device because I met a friend, Dr. Marek, and we started a company about 9 years ago. It has been very successful. Among the achievements in homeopathy, we were able, with a group of researchers at Miami Children's Hospital, to demonstrate that two formulas, one is used for the flu, one is for chronic disease, had some action on the cellular level. It's been published. It shows that homeopathy can increase the cytokines at the cellular level. So homeopathy is not just a belief system, it's also a reality as far as science is concerned. So about 9 years ago, I had that crazy physicians who came from France, and I went and he had some machines. And I love machines, I love technology. So I started to work with him. And now we have a device which does HRV that you've seen, who does also the assessments of peripheral arterial disease by using a technique which is called ABI, ankle brachial index. We're doing also some electrode, some understanding of neuropathy, C-types neuropathy. We look also at the endothelium. We look at the endothelium function, and we'll use some data to understand the cardiac neuropathy. That type of device is very expensive. It's used by doctors, but there is some reimbursement codes. So as you've seen with your technology, there is some technology with HRV which is ambulatory that you can use easy. And there is also some more elaborate technology, but it all goes in the same directions to be able to understand the physiology of the patient. Because I'm going to share something with you, is your patients lie. Your patients lie all the time, and symptoms are not sufficient. We have our belief system also. But you have the patient who says, I'm feeling perfect, I'm feeling very good, and the day after the wife calls and says, my husband is dead. And you have my mother, 91 years old, complaining since 30 years, and going to the funerals of different doctors because she's complaining, she has a lot of symptoms, but she's still there. So I practiced and lectured in different countries, and I even practiced in New Caledonia. And it was very interesting because I had a patient, and he was sitting in front of me, and I will ask him if he was a patient of the doctor I was replacing, and he was not answering to me, just moving his eyebrows, not answering to me. So I said, my God, I'm starting to practice, and they don't want to talk to me. They don't like me. Then I asked him if he was taking some medications. Nothing. Did not answer me. Getting very frustrated until I understand that the patient was saying yes by moving his eyebrows. As in certain countries, to say yes, you just move your eyebrows. So the way we see things can be distorted. We were talking about reality. What is our reality? There is one reality that you all have a different names, and you all have a different genetics. So it is time now to go to the root. You don't build a house without knowing the ground. If it's sand, if it's rock, you have to know the genetics to understand how your patients will function and how he will respond. So there is genetic testing, which is looking at the chromosomes and find out if there is a relationship between a gene, a chromosomes, and a disease. And the DNA will trigger the formations of proteins, and those proteins are the ones which are acting at the cellular level. So we can look at the end result by looking at a blood test, and we can find the level of a substance in the blood. But we can also go to the DNA and see what is the program, what kind of information it's sending, what kind of protein and cellular mechanisms are going to be involved. We are at the quantum university, and everything is vibration. And when you look at the DNA, you see that it has a shape of a vibrating because the DNA is vibrating. And not only the DNA is vibrating, but there is a study which just came out in July 2017 that the electron found on coupling are dancing. So our DNA is vibrating and our body is dancing all the time. So yes, we are doing energy medicine when we look at the DNA, and we can understand a lot of processes which have to do with the changes of our cellular metabolism. You can look at yourself, at your dad, at your mother, and find out, what did you get from, You get the bad temper of your mother. You get the craving of your father for sweets. So definitely, when we say when you want to marry somebody, what you have to do? You have to look at the mother. If it's a woman, you have to look at the father because he says in 20 years, that's what I'm going to get sleeping with me. So the genetic is important. So we can do different types of testing. We can do a carrier identification. When you go on your sites to find out the right partner, maybe you should ask them for their DNA because you don't want to make babies who have issues. So I think it will be very important. In fact, I can tell you I will like that we think one day of changing the world by having some permit to make children. I think that, this is a tragedy. We have permit to drive a car, permit to drive a house, permit to open a business, but we just make children without knowing what we're doing, and those poor children are suffering. So we need to regulate, and I think it will be very important for our patients to be able to check their DNA to find out what's going to be the risk factors. When the baby is in utero, you can do an analysis to find out if it's going to get Down syndrome or other types of disease, and now it's mandatory in certain countries to do those evaluations to find out about the decisions during pregnancy. You can do some newborn screening. When the baby is born, you're going to check if he or she has the risk of a genetic disease. But also you can do some late onset disease testing. For example, my father is starting to have some Alzheimer's, so I check my genes to find out what is, and I'm not going to tell you what are my genes, but if I forget something in the lecture, you will know. So we can do different types of testing of carrier identifications, prenatal testing, newborn testing, and late onset testing. But what we will describe today is the wellness. We're going to look at the genetic for wellness, and I will describe 3 types of evaluation that you can do with your patients. One has to do with weight loss, one has to do with longevity, one has to do with the genes for nutrition. So we know now that in standard medicine, we can select the best treatment for a cancer or HIV based on the genetics. Because many of our patients tell us, look, I'm not feeling very well with that medication is not really working. Keep taking your medication. But doctor, I'm not feeling very well. Keep taking your medication. Now we can find with pharmacogenetics to find out if the patient is right, and maybe that medication is not working on the genetic level. So we'll be able to select another medication. The patient at that time is having more understanding of his condition than yourself, because you're going from the books, from the knowledge, and he's getting from some of his symptoms. So how do you decide of a treatment? Clinical, right? Symptoms. Patient lie. Patients sometimes don't understand what's going on. Conventional, we can do a lot of blood tests, cholesterol, LDL, sugar. We can do some experimental. Some of you have experimented with some of the techniques, with kinesiology, electroacupunctures, different modalities. A lot of those modalities might be important for the relationship with the patients, but they lack scientific validity. And also we have to understand the chronobiology of the patients. Some people do some muscle testing. You do muscle testing in the morning, in the afternoon, at lunchtime. It depends on the belief system of the patient, the belief systems of the doctors, the environment. Electroacupuncture, the same. I've tried the electroacupunctures for many years, and it depends on the time you're testing, because our body is not stable. Our body is always in movement. We looked at the DNA, we looked at the cells. So we have to understand something which is stable. And the only thing which is stable in our body is our DNA. Knowing that we can act also on the DNA. We can reprogram the DNA by nutrition, by exercise, because sometimes this is the expressions of the gene who are going to create the disease. Not the gene in itself, but it's the expression of the gene that we can work on. So we will look at genetic-based pharmacology. For example, there is a company who's called One Home Company. They analyze 22 genes, and there is other companies who do the same thing, and they look at the absorption, the distributions, the metabolisms, and the excretions of the medication. And for example, they can test you for anti-inflammatory medications, if you can tolerate that medication, medications such as simvastatin, even caffeine, hormones, omeprazole, a lot of medications for cancer or neurological disease. And what you get a report who tells you there is a gene-drug interaction, a moderate gene-drug interactions, a minimal gene-drug interactions, and give you a nice printout of which medications the patient can tolerate and which medication he cannot tolerate. I know a lot of you are not in pharmacology, but I can tell you there is a time for a diet, there is a time for an advice, there is a time for a nutritional supplement, and there is a time for chemotherapy, and there is a time for surgery. So we cannot in this world say that all pharmacology is bad. Pharmacology at a certain moment will save a life. We will describe about diet in your workshops with the captains that we discussed yesterday. But there was a guru who described a diet was called instinctivotherapy. I don't know if you heard about that. You eat according to your instinct. So we'll put a lot of different raw food, fruits, vegetables, meat, and whatever the patients will feel, they will eat. And he will say, you're going to all get better, until he went to jail because 4 of the clients had stopped insulin and died from their complications of diabetes. So we have to understand that there is a time for everything, and we don't know everything, and we have to respect doctors which are using medications, as they have to respect people which are using nutritions and which are using different types of modalities. How do we do tests on genetics? We can do it on the blood, we can do it on the amniotic fluid, and we can do it with the saliva. So it's very simple. You take a saliva sample, you send it from anywhere in the world, and they analyze your SNPs. And there is different level of analysis you can do, and the price, which were $3,000 now, are going down. So we're going to get a lot of opportunities for us to educate our patients, to deliver better treatment, to be a better practitioners if we learn and incorporate genetics. And you can use any company you want. You can do whatever you want with genetics. But genetics is going to be the futures of health. Because I believe at one time, when you are born, you will get your social security number, but you will also get your genetic testing because it's going to save money. And that's why the FDA is opening direct-to-consumer genetics, because they know if you educate the patients, if they change their lifestyle, if they do the modification, we're going to get less diseases. And if we don't get less diseases, we're going to get a major economic crisis in all the modern world. So we can do also some cancer genetic test, but that's not what we're doing today. And a lot of researchers say the future of cancer care is here, combining advanced diagnostic technology with personalized treatment options to pinpoint the therapies most likely to work for you. Advanced genomic testing is a tool we can use today in the ongoing search for better ways to treat cancer. So yes, as a therapist in mind-body medicine, we are looking always for new solutions, but also with genetics, we are looking for new solutions to adapt. And why not to understand that we can also use nutrigenomics? It means that we're going to decide based on the DNA what our patient is going to need. Because all our patients are taking supplements, yes? Supplements which are not necessary. Supplements which might creating other imbalance. Supplements that you take for years and not for months. So we need to have a little bit of science to be able to help our patient population. So we talk about genetic diseases, cancer risk, disease risk, pharmacogenetic. We're going to be talking about wellness. So we have 3 programs, one for weight loss, one for healthy aging, and one for nutrients. So what are SNPs? SNPs are some of the genetic difference which might be important to human health. And especially SNPs are very important for heart disease, diabetes, and cancer. So we will review 3 types of genetic testing that we can do: the SLIM, the Renew, and the nutrients. And yes, you can do some combo evaluation with certain patients, even certain patients that have already done a test for their heredity factors. They want to know what is their genetic background. And when they have done the 23andMe, you can access that information and send it to genetic directions to get also an analysis of the diet, the Renew, or the nutrients. So that genetic material, you do it once in your lifetime. It's not like you have to repeat your blood sugar every morning. You do once in a lifetime your genetic makeup. So you can combine different types of combo evaluations, SLIM on nutrients, 23andMe, nutrients on Renew. So you can combine 80 types of evaluation. Definitely more evaluations, more money the patient will have to spend. So you can see here the 3 profiles that we propose at the moment. We have the GxSlim. We're going to look at food summary, protein utilizations, fat utilizations, carbohydrates, vitamin A, B6, B9, B12, C, and D tendency. This is not the level. We are not checking the level. We are looking if there is a genetic issue to process vitamin C, to process folate, to process iron. We are not looking at the levels. We might have to combine with an understanding of the levels of nutrients, but there we will see what is the trend for the patient. We have also the GxRenew. Sorry, there was also exercise, fat loss, fitness, body composition, HDL, insulin, glucose response to cardio. Because we have to do something out, we have to remove the guilt of the patient. Because what is guilt? Guilt is the mafia of the mind. Guilt is taking energy. And you have those frustrated patients. They've seen 1, 2, 3, 4, 5, 6 practitioners, and they tell them, do your F diet and do your F exercise. I'm fed up to see you. You're not losing any weight. You're not doing better, and so on. And the practitioner is upset at the patient. The patient is upset at the practitioners. And why? Because they don't understand. They don't understand that that patient has a particular predisposition to diseases, and we have to do some specific modalities for that patient. And we will see how it works. You have also a profile, which is a profile who's looking at sun sensitivity, skin aging, skin glycolations, facial aging, stretch mark, motivation to exercise. Why do people exercise and some people don't exercise? You're not doing it. They're not doing it because they have a genetic predispositions that they have muscle fatigue, or they're not able to motivate themselves, or they have an addiction to alcohol or other things. Everything is in your genes. We can look at the feelings, sleep duration, sugar intake, mental acuity, age-related hearing loss. We have also a gene for longevity. Life is not fair, huh? Okay? Some of us are born, we had longevity age, and you know all those guys who've been smoking up to 105, and they have a big smile and says, I've been smoking and drinking all my life. That's the genetic advantage. And you can look also at the cholesterol response to fat, because some patients will respond to diet, some patients will need to have other types of modalities, pharmaceutic modalities to reduce their fats. Lactose intolerance, and we have also the nutrients, who's going to look at some specific markers which are part of the SLIM and which are also part of the GxRenew. So you're going to custom design your evaluations on your protocol based on the patient's needs. If they have some problems to lose weight, you will propose them the SLIM. If they have some problems with their skin, which is, I lived in the islands for many years, and I just burned some of my spots here because we have a certain potential for damage, and melanoma is not a joke. So definitely if we can do some preventions to protect our skin early in age, we can make a big difference. And also some patients have had some vitamin B12. I'm feeling better with the vitamin B12. Should I continue? Should I stop? What should I do? There you can get the basis for a proper treatment. So GxSlim is a weight management program that takes your unique genetic makeups into account and provides you with a diet and exercise strategy that are tailored to your genotype. This is not guesswork, one size fits all, or a fat diet of any kind. It's based on the DNA. And in the workshops, we will review you with your captain's 24 diets, find out if there is a diet for everybody, because when you're in practice, you read a book, and the week after, you give the same diet to all your patients because you read the book, you're enthusiastic, and so on. And after that, you read another book, and he says, no, I told you Atkins. No, we changed now. This week, we're doing the zone. So you do the zone diet, and you read another book, and you say, no. Now I'm going to do the blood type diet. No, this is not what we should do. We should educate ourselves in many diets and adapt the diets to the particular patient. So we looked at diet based on medical conditions, diet based on lab work, diet based on belief system, religious and esoteric, and we have to play with our patients. Sometimes they have a belief system, and they're vegetarians, they're exhausted, they're depressed, and you says, let's go and have a steak. And he says, no, doctor, no, please, I'm a vegetarian. You know that real vegetarians do not exist, right? Because at night we all swallow flies on different insects. So we have to find a way to supplement them in a different way. And I can tell you, as a rule of thumb, if you have a patient which is a woman who's exercise, which is tired and depressed, check her iron level and check her ferritin. And you find out that many of them, because of the menstruations, they get some iron deficiency. And you can do all the therapies, they can meditate, they can do yoga, they can do whatever you want until you give them the iron supplement where they're going to say, oh my God, what's happening to him? I've got the energy, I'm not depressed anymore. So there is some patterns of nutritional deficiency that you have in your practice, and you have to address them, but you have to look at it. Otherwise, they're going to go and see somebody else, and they say, oh, hey, you've been treating me for 15 years, but I went to such a therapist, we did an iron test, and now I'm taking iron and I'm feeling better. So sometimes if it does not work, there is a reason, so we have to look at it. So this is the types of report that you're going to get. So you see on the upper side, you have some of the SNPs, FTO, TCF, MTN. You don't have to know them by heart. I will describe some of them. All the literature is in my presentation. I'm not going to bore you with the detail. Thank you very much. But that's where we base the decisions that patient has possibility to lose weight with diet or exercise if it's below average or if it's normal. If it's below average, the same exercise is not going to work the same way. The same diet is not going to work the same way because those patients have impaired genetic informations. They cannot lose weight easily. Same thing for protein, fat, carb, and all the nutrients we can describe. And you see Robert, before and after 2 weeks, he lost his glasses. So the issue with Robert, that is born with FTO, TCF, MTN, PPRG, BDNF, and ABC. That's not his fault. There is a genetic predisposition. And for example, what we test with the genetic directions, we test 1, 2, 3, 4, 5, 6 SNPs. On those SNPs, I'm not going to bore you with all the results, but for example, the FTO is one of the SNPs who's been linked to nervous cardiovascular system issues, body mass index. There is a direct relationship between body mass index and FTO. So most of your patients who have a high body mass index, which are not able to lose weight, they have the FTO SNPs. But also, we're not talking about medicine and diseases because this is a wellness, but I'm going to still tell you, under my responsibilities, that when you have somebody who have the FTO, they have a high risk of type 2 diabetes. So you will be able to determine which patients are going towards diabetes based on their genetics. You cannot diagnose, but you will get that information, and more information is coming into that direction. So you have also the TCF7, increased risk of 2 diabetes, the MTNR, diabetes type 2, PPRG, obesity, diabetes mellitus, but also they will have some changes into their vascular system, into the endothelium, so those patients have a risk of atherosclerosis. So they might have a normal diet, but genetically, they're going to do vascular diseases. Some genes have been linked to psychiatric or psychological issues such as bipolar disorders, anxiety, and eating disorders. So if they eat too much, it's not only their responsibilities, it's not only the ecosystem, the environment, there is also some genetic predispositions for them, psychologically, to be able to have the wrong types of diet to calm their anxiety. When I was in practice in the West Indies, I had those patients who were coming to see me with weight problem, and they will tell me at 23 I was good, and I met that guy, and we had a relationship, we had a kid, and he left me. So I was 26, I gained a little bit of weight, and I met another guy, and we had love affair. It was fantastic, and I get another kid, and he left me again. And now she had 4 kids, and she was in love with the fridge. Because we are looking for satisfaction, right? Mentally, body-wise. So some people, unfortunately, their level of consciousness hasn't changed. And instead of looking for pleasure into the nice meditations that Paul lead us today to practice, they get the satisfactions from McDonald's, Kentucky Fried Chicken, because we've modified also their way they feel the food and so on. So those people have different level of consciousness, but part of it is due also to their genetics. So it's not easy to be born with good genetics, We have to thank our parents when we have good genetics. We have also some genes which are linked to liver disturbance. And I'm a big believer of the importance of the liver into the health of our patients, because this is what we need to do. And we have also a SNPs, which is IRS1. I know nobody likes IRS, but it's a nice way to remember. IRS1 has to do with carb utilizations. So those people who have that genetic predisposition, they cannot go on carb, and they will do much better with the types of Atkins diet. We can also find out if they can utilize the proteins, the fat, the carb, based on their genetics. And you can see the FTO, you're already familiar. This is the genes for problems to lose weight. IRS1, diabetes mellitus, non-insulin dependent, a multifactorial disorders of glucose homeostasis caused by a lack of sensitivity to the body's own insulin. Affected individual usually has an obese body habitus and manifestations of a metabolic syndromes characterized by diabetes, insulin resistance, hypertension, hypertriglyceridemia. The disease results in long-term complications that affect the eyes, kidney, nerves, and blood vessels. I think it's going to be interesting. I've been walking in Hawaii, and I find out that there is probably a lot of IRS1 walking the streets. And sometimes when you see a patient and you have that IRS1, you might want to think their family tree and their relationship, and one genetic test from one member of the family will give you some indications on the rest of the family. There is also some SNPs which might affect the eyes, kidneys, nerves, and blood vessels, and we have some markers now of macular degeneration. I don't know if you're all familiar with macular degeneration, because it's a terrible disease. I've got a good friend who has it, and every week his eyesight is diminishing, regardless of the therapies, and he's going towards blindness in a very slow and painful process. So we should identify those patients in time, because we have some modifications of the diet that we can do to prevent the problems of macular degeneration. How do we understand the B12 level from the genes? Because there is a gene, which is the FUT2, which is something who's influencing the vitamin B12. So it's good to check your vitamin B12 in the blood. It's good to take a supplement if you need, but it's also good to identify if they have a genetic risk of vitamin B12 deficiency. Exercise. Some people will respond to cardio, and they will be able to lose fat loss. Some of them won't be able to do it because they have those SNPs. Some of them will get fit from cardio, some of them will not. Body compositions will respond to strength, so you can look at cardio, at strength, and decide what is the best program. And what the report from genetic direction is doing is giving some indications of what type of exercise your patient should do, the length, the durations of the exercise program. So this is not just based on the belief systems of a personal trainer. This is based on the reality of the body function. We can also look at the HDL, the insulin sensitivity response to cardio. Will our patient who has diabetes, will respond to an exercise program, yes or no. You have here the response to see if they're going to do well or not. Okay. So that's the LIPC gene. Age-related macular degeneration is an eye disease that is the leading cause of vision loss in older people in developed countries. It affects the central visions, and we find out that those macular degeneration has some genetics predisposition. So it will be important to look at the LIPC gene in our patient and start to a therapy in time. So the report will give you a summary of how much the patient should take as far as proteins, as fats, or carbohydrates. And it will also give you the percentage and the amount of grams of proteins, carbs, or fat they should take. They will also guide you into a supplementation. There is no link to any companies. It's not a multi-level marketing. We don't promote any types of specific nutrients. You can use whatever you want, and you can tell them to get it from their food source, which might be the best way. Pinto beans for the folate, kale, tuna for the vitamin A, pistachio for the vitamin B6, B12, some dairy products. The problem is that a lot of people don't take the dairies. Vitamin C, vitamin D, which is very important, and we'll go back into the need for the supplementations and what type of we use. The exercise, the frequency, the intensity, the duration. Because, we have a problem. We have the weekend warriors, right? They go to their physicians or their trainer and say, get to exercise, and they overdo it, and for 2 weeks they cannot move because they were not used to do it, and really you do not get any benefit. They're not going to go back and exercise because they feel the pain, says, no, it's not for me. So you have to teach them the frequency, intensity, durations, but you have a scientific basis for your suggestion. So they can design the plan, designs for you, omelets, potatoes, mixed berries, quinoa. You will have to modify because maybe some of them have an allergy to one of the food which is suggested. So this is just a guideline. You just don't give them the diet and says, go for it. You have to use your mind because whatever technique, whatever evaluations depends on the intelligence of the practitioners. But the more you get educated, the more you're able to provide the right solution for your patient. So GxRenew is a healthy aging. So we look at sensitivity, skin aging, facial aging, stretch mark, skin glycation, very important, fat loss response to cardio, body composition response to strength training. We not equal as far as our skin is concerned, and the people with blue eyes, fair skin, the redheads, they will have a higher risk of melanoma than the people of darker complexion. This is just common sense. So not only the skin color, the hair color will affect what kind of diseases you're going to do in the future, but also your genetic predisposition. And everything costs money, but there is a lot of ladies, and I would like to know what is your budget for skin cream and what it is based on. Is it based on reality, a scientific reality, or maybe you're putting things on your skin that you don't need or which are not necessary? The genetic testing, if we do one genetic testing, I compare with the longevity in the US, it will cost you 1 cent a day because the genetic testing is for lifetime. And we will show you and discuss also that you can ask that company or any company to keep that data up to 10 years. So that data can be reevaluated when we're going to get more and more research because the research is exponential. So we will be able to get you more data to your clients based on the DNA that they've done 5 or 6 years ago. So really, they store it in the bank if the patient authorizes you, the client authorizes you to do it. So one of the factors of the aging of the skin is the glycation factors, which is a bonding of the sugar molecules when there is an issue with one of the enzymes. And it's very important to understand what is the glycations of your patients to see what kind of prevention and therapy they should do. We have also a link of the SNPs. And for example, some people have addiction. Alcohol, drugs, that addiction has some genetic basis. So we can change their addictions maybe to meditation, to yoga, to exercise, to love, but you have to find out that those patients have a predispositions to addictive behavior. They can have an addiction to impulse. They can have some problem with sleep duration. They can have some genetic predisposition to sugar intake. This is part of the Renew program. If you have a patient who has DR2, there is a lot of link between schizophrenia or other types of mental and psychological disturbance, such as tremor, facial tics, rigidity, slow movement, inability to move, which are common to that gene. So you're not going to diagnose schizophrenia with that genetic, but you will find out that maybe they have some signs of symptoms such as hallucinations, or they have some different relationship, and it's based on their genes, not just on their partner. We all want to find out if we have a cognitive decline with aging, and we are not equal. Some of us will decline faster than others. Same thing with the age-related hearing loss. And the most important genes are the genes for longevity. And there is two that we check. The FOX03, which is the genotype which is strongly associated with human longevity. So very important. If you have the benefit to have that genotype, you're very lucky. And in fact, they should not charge you so much for insurance. Fitness response to cardio, systemic inflammation, very important. A root of many of the diseases are inflammation-based, and your captain will describe with you the anti-inflammatory diet, but there is also some response to fat supplementations, the response to dietary fat, the insulin response to fat, the triglyceride response to cardio, lactose intolerance, calcium level, copper level, magnesium level, choline level, selenium level, zinc level. So how those genes are related to your blood copper, selenium, and zinc? There is all the studies. This is a very serious science. This is based on many articles and publications. So when there is something, this is not an imagination. This is based on studies of the relationship between the genomes and some body functions affecting the blood copper, the selenium, and the zinc. Once again, this is not the level. This is your predispositions to have a disturbance of your copper, your vitamin E, your vitamin D metabolism. There is a lot of studies which are on the website of Genetic Directions, but you can also look at PubMed and find the relationship. The third profile is called GxNutrients, and it's looking at the possibilities of absorbing micronutrients in your diet. Because when you take a vitamin or supplement, what do you know if it's doing the job? Right? Because you have an absorption, you have a metabolism, maybe you're not able to absorb that specific forms of vitamin E or vitamin D. Maybe you need some cofactors. Maybe you need some iron with vitamin C. So it is a science. So taking in your mouth does not warranty that it's going to function in your metabolism. So we have a summaries of the vitamin A tendency, vitamin B6 tendency, folate tendency, vitamin B12, vitamin C, vitamin D, vitamin E, D3, choline. Vitamin D has 3 SNPs, which are related to vitamin D, and vitamin D is fundamental. You all need to have your vitamin D tested. And you might be living in the sun. I practice sometimes in French Guiana, where we have a lot of exposure to the sun. And a lot of the patients, especially people who have metabolic syndromes, overweight, have vitamin D deficiency. So I encourage you to check the vitamin D on your patients. And vitamin D seems to be associated with longevity. So if you have the good gene and good level of vitamin D, you're going to dance very well on the cruise tomorrow. We look at the calcium levels. And once again, when you take in your mouth, it might not go into your bones. Copper level, iron levels, magnesium, phosphorus, selenium, zinc level. And as you can see, sometimes this is not just one SNP. This is 1, 2, 3, 4, 5, 6, 7 SNPs who give you the reality of that issue with your metabolism. This is not a simplification. Once again, those profiles are not 100%. You have to use your brain, you have to use your knowledge, you have to use all the tools that you have been using for many years to be able, you're going to just add that new science to your evaluations and treatment of the clients. So sometimes you're going to find out that your patient has a tendency, for example, not to process vitamin A. So you might want to understand also that vitamin A can be very good, but can be very bad. So you have to be able to reassess, and that's what you will do in the follow-up of your patients. If they have a vitamin A tendency, you might have to use some modalities to find out, because too much vitamin A can create a lot of medical issues. And sometimes people don't understand that they're taking a supplement, they're taking food rich in vitamin A, and a lot of symptoms are due to supplementation. So supplementation nutritions are good if it's done in a scientific manner, because that can affect your patients negatively. Vitamin A is very important for night vision, xerophthalmia, keratomalacia, complete blindness is a major issue with lack of vitamin A. So the supplements, what do we suggest after you've done the genetics? Supplements once a month, then follow the diet recommendation, because sometimes it's going to be easier to supplement them with food, who's going to be better absorbed, who's going to be less toxic. So just help them to change their lifestyle and also observe for the risk of over-supplementation, because sometimes you tell them take so many units of vitamin A, and they're going to say, look, I'm going to make it work faster. I'm going to take 3 times the dose. So you have to also educate your patient in supplementation. Okay, folate are very, very important for the neurologic defect, but long-term supplementation is associated with small reduction in the risk of stroke and cardiovascular disease. So vitamin D, folic acid will be 2 of the major nutrients that you want to explore with the genetic testings to help to decrease the risk of stroke and cardiovascular disease. And I think Paul mentioned in one of his lectures, the amount of risk of the patient suffering from cardiovascular disease, which is one of the number 1 cause of illnesses. But also it can have some effect on the mental, and we find out that folic acid, in addition to antidepressant, may have some benefits. So I told you on your patients which are depressed, check their iron level, but check also their folic acid and consider supplementations of iron and folic acid before they go to their doctors to take an antidepressant and maybe start to be in an agitated state and start shooting people out of a high building. Age-related macular degeneration, very important, very important. I see my friend Andre, and every week he's suffering, his eye, he cannot read his newspaper, he cannot read anything anymore. And it was a very active gentleman. He's 86 now. He speaks 7 languages. He has traveled the world. Very, very nice person. And every week he calls me that his vision is going down, down, down. If we could have identified the problems 10 or 20 years before, will make a big difference. So we have to catch the disease process, the imbalance, early in time. We cannot wait the last week of health to change the report. So macular degeneration can respond to folic acid, pyridoxine, vitamin B12, and can decrease by 34.7%. So definitely we need to be proactive because it's going to be cost effective, but it's going to also change the outcome of the patients. And you have the requirements. Choline also is very important to consider because a lot of the choline imbalance are linked to different conditions, mainly neurological, but also atherosclerosis. Because what we have now, one of the disease, and sometimes we discuss about your new organs, there is 2 new organs that you have to consider. One organ is the digestive system with the biotome. All your bacteria are much more important than your DNA in the function, but it's still not well understood. So there is some testing that you can do on the biotome, but at the moment it's a little bit fuzzy technology. And the other one is the endothelium, because the endothelium is everywhere. And our endothelium disturbance diminished nitrous oxides and diminished a lot of the body function with oxygenation and create the atherosclerosis. And we have to look at atherosclerosis 10 or 20 years before we have the first symptoms. Same thing with diabetes. So we have to be proactive. Some of your patients will benefit because if you educate themselves, maybe they're going to educate their children and they're going to be able to change the outcome. So vitamin B6, you can take it in supplement, but you can also be careful because if you take too much of the vitamin B6, you can get some irreversible neurological problems. So once again, supplementations need to be documented. DNA, blood test, good communication with the patient. So vitamin D. Why is vitamin D so important? There is at the moment on PubMed 27,000 publications on the importance of vitamin D. But vitamin D is an epidemic, and we can find out that there is a novel hypothesis published by Burridge where it says that vitamin D may act to control the rate of aging. So sometimes let's keep things simple. Iron metabolisms, vitamin B metabolisms, vitamin D metabolisms. You don't have to be too esoteric. Just keep the most important genetic predispositions and test on those essential nutrients. Magnesium also. Wow. Magnesium, very important. The issue, for example, is that Medicare does not reimburse for magnesium. So a lot of the doctors are CPT dependent. You know about CPT codes? You don't know? CPT codes is the way for the doctor to be reimbursed. So if it's not CPT codes, they're not going to consider it. I don't get reimbursed, so I don't care about it. So magnesium is not reimbursed, so none of the doctors are, except the holistic advanced physician, will check for magnesiums. But magnesium deficiency had been linked to osteoporosis, high blood pressure, clogged arteries, hereditary heart disease, diabetes, and stroke. And we have an epidemic of vitamin D and magnesium deficiency. Magnesium also is very important for neurological diseases, hyperactivity, anxiety, chronic fatigue, Lyme disease, fibromyalgia, cystic fibrosis, alcoholism, mania, recovery after surgery, leg cramps at night, diabetes, kidney stones, migraines, headaches, and some different pain symptoms and PMS. Important, right? But we don't test for it. What a shame. So circulating magnesium level or incidence of coronary heart disease, hypertension, and type 2 diabetes mellitus, a meta-analysis. It means that it looked at many, many studies. On findings, this meta-analysis suggests that circulating magnesium levels are inversely associated with incidence of hypertension, diabetes, and all those conditions. So definitely magnesium, testing it on the genetic level and on the blood test and supplementation will be very important. And also the issues with magnesium, they're very low toxicity, sometimes a little bit of fast bowel action. So once again, I told you that there is 3 profiles at the moment with different components. So I don't know what you do, but a lot of you do of what we did, of what I did, was guesswork. We can do some functional evaluation, very important, but we need to do genetic tests. Maybe you're not ready for it, maybe you will be ready later on, but this is the trend, this is the science, and you need to know about it, and if you want, incorporate it to your practice, because you have the power to do it. There is direct-to-consumer genetics testing. FDA approves it. So you can do it for wellness. This is a tool that you have at your dispositions. I will look at the rationale as far as the type of practice you have, the financial reward by getting into genetic testing, and I encourage you to study it, to look at it, and see when you're ready to do that. Because guesswork can lead to the wrong advice. And wrong advice leads to human and financial cost. Do we want our patients to live 10 years longer, fit and healthy? Do we want them to spend their money at $300 a day in the nursing home to be under tubes and things like that? No, we have to be proactive. We have to be able to grasp the disease, the imbalance in time. It's a one-time life evaluation. What will come in the future? We will add some new markers. The genetics is going very fast, so we'll be able to really re-evaluate your patients by getting more SNPs. We'll have some new studies. It's going to be probably some link with the microbiome. And there is the GxPerform, which is a genetic-based peak athletic performance program, was coming out in January or February. How much does it cost? I told you 1 cent a day if you live 75 years. If you live 50, it's a bit more expensive. If you live 90, it's a little bit less expensive. So what is the cost to the patient? $349. If you test yourself or some of your clients during the symposium, the cost will be $195. If you want to use a combo with 2 tests, $295, a combo with 3 tests, $345. This is not a multi-level, but there is an associate process where you can be an associate of genetic direction. You will have to sign some documents because it is HIPAA compliant. It means that you cannot share that information. It's privacy of the patient and so on. So you will have to go through a process. And to be an associate, you will need to buy 5 kits. The kits are at $20. And during the, if you want to buy some of the kits, I have plenty of kits. You go with the kits. When you're ready, you take a saliva. You send it to the lab. In 20 to 30 days, you get your report. If you want to get the $195, you will have to make sure that you let me know because there is a code. And you have to make sure you put that code to get that special price, and that special price will be for 30 days. You can order online, thegeneticdirection.com, but if you go directly to them, you're going to pay $349. You will not benefit, so please send me an email. I send you my email so we can help you to introduce that new technology, new evaluations at a moderate cost. So what you will get when you get your patients, they will give you the DNA kit with the name of the patient. The report is ready, and they will send the report to your patients, and you have access to it on the website with your name and a code. Then you will get report is ready, what kind of test. Very important that you tell the company that you're sending the DNA for the slim, for the nutrients, or for the renew, or if you want to do 2 or 3, because sometimes it can be a mistake. If a very skinny patient gets the slim, they don't understand why you did that DNA test. So you have to make sure that you are precise. Then you have a questionnaire, you have the genetic data, and you have the full report. So the health questionnaire is something which is filled up by the patient. They have also to sign a disclaimer to accept the conditions that their DNA might be stored. So you have here all the different relationship between their genes, and if they are variant, heterozygote, homozygote, that's where the data is based. So what are the benefits of genetic testing? Number one, stop the guilt. We don't want our patients to be guilty. You are not responsible of being a diabetic. Might be a little bit of the diet, might be a little bit of the environment, because we live in a sugar-high society. In fact, if we want to save the economy, we should do a sugar tax.
Yes.
Huh? Yes. Sugar tax will be good. I went to China a couple of months ago because we're having our device might be used in some of the which is used in some of the hospital. China is getting an epidemic of diabetes. Why? Because we changed from a society where they were spending a lot of calories working and having some very limited food and more protein and vegetable based, and they went to the sugar. And their economic growth is going to diminish tremendously because the cost of looking after those patients is a catastrophe. At the moment in the States, if you have diabetes, you have to spend $15,000 more on health a year to be able to deal with that diabetes, depending on your insurance and so on. So definitely there is some responsibility that we have towards our patients, but also towards society if we do something or we don't do it. Get answers you cannot get from other evaluation. You've done everything. You've done everything, and you're still not getting your result you want. Why? Because you have to use other ways, other modalities. It can be HRV, it can be other types of modalities, but genetic testing is part of the solution. Improve your standard of practice. The more you know, the better you are as an individual. Your patients have more satisfactions, and also you improve your services and income because you're going to generate, and I think we all have to strive for health and wealth. We should not give the wealth only to the people which have not the same vibration level as we have. We have also to consider our own financial well-being. So the benefits, prevention of skin aging. Any woman who does not want to have a prevention of their skin aging? No result with your therapies and from other health professionals. This is that patient, she's seen everybody. And she comes to you and she's frustrated. She tried acupuncture, she tried naturopathy, she tried going into a fast, nothing is working. So you have a new understanding of her conditions. And we can reverse some of the genes predispositions by increasing their exercise and modifying the diet. This is the expression of the gene. Genetic-based strategies and therapies. I told you the blood level might be very expensive. To repeat it every month and 2 months, you might lose sight. Here you have the genetics, and you know that that patient has some possibilities of vitamin B12 deficiency, and it will be for the rest of their life that you will have to monitor that vitamin B12, and because we all want optimum health on age prevention. This is a young lady, and she has that chronic skin condition, and what is she doing? Taking local corticosteroids, right? Taking a therapy to stop the symptoms is just like stopping the ring of your iPhone without picking up the phone. Okay? So we have to change the mind of our patients. Yes, the corticoid cream is going to give us some immediate result, but we're not dealing with the issue. So what we did a genetic test, and we also told her to go on a gluten-free and lactose-free diet. And we did some supplementation based on the DNA, and we find out that her situations in 2 weeks has greatly improved, and she's not using the corticosteroid cream anymore. So definitely you can document result immediately. Is it the lactose? Is it the gluten? Or is it the supplementations? I don't care. Every diseases are multifactorial, and our therapies should be multifactorial. Maybe later on we can tell her to go back on gluten, see if she has a flare. Maybe we can tell her to go to have a French cheese, nice brie, and red wine, and see if she has another flare, but we'll be able to understand the patient relationship. But what do we see on that patient? That she has a vitamin B12 deficiency, and she has also a vitamin D deficiency, and she has also an issue with her iron. So I'm sending her to the blood test, I don't have the result yet, where we're going to do a level of vitamin B12, vitamin D, on ferritin, on iron, because too much iron can be an issue and so on. So I'm doing a therapy, a follow-up, which is in very short time gives satisfaction to the patient, but also intellectually, I know what I'm doing. I'm making some progress in the understanding of the patient conditions and the therapies that we should do. It's another friend, she's a diabetic, and she's not losing weight. Nothing works, and looks. She has a genetic predisposition. She has type 2 diabetes, and she has also some issues with vitamin A, vitamin B6, vitamin B12, and fat loss response to cardio is low. So this is not a guilt. We might have to help her to do more exercise, but definitely she has some genetic predisposition. Are you going to make your patient spend money for nothing? Or are they going to benefit from it? A study, 2017, behavioral changes, sharing behaviors on psychological response after receiving direct-to-consumer genetic test result, a systematic review on meta-analysis, and they find that 23% have positive life change, 12% for dietary and exercise. So 33% share their result with any healthcare professional, and 50% with family and friends. So what it means is that there is some benefit using that genetic testing. But the genetic testing is going to be as good as the therapist, right? Okay, you can do the test, and some of them, they just do the test and they get better. Somebody mentioned about intention. Okay, so they have the intention to do their health, to change their life. So already they're going to do better, but I think that the cost benefit is very good. And even they find out that there was some positive changes regardless if they were following the diet and exercise. Can we change the genetic expression? Yes. Physical activity attenuates the effects of the FTO genotypes on obesity traits in European adults. So we find out that even if a patient has a genetic predisposition, you still have some strategy to diminish that genetic predispositions by some specific measures, diet, exercise. So you have the power. The power is in your hand to change the life of those, first identify, then help them to modify their health status. What's important is that you have the possibilities for your patients to keep that genetic material. You have the paranoid who have no cell phones, which are not on social media. They don't want to be known, so they want you to discard their DNA, and they have the right for the DNA to be discarded. But for the other ones, they can give a consent to have their DNA stored 1 year to 10 years. So we will be able to assess that information when there is new programs, to give them some new advice. So that test that they did once a year might be giving them some health benefit for the 10 years to come. And definitely we will be able to update the informations, update the strategies, even years after we have made the test by reanalyzing their DNA. In your workshop, which is going to start in a few minutes, I would like you to guess what is the positions of the USA in the world regarding life expectancy. Important to know if we're doing a good job. We want also to know what is the health expenditure, how much it costs to have those patients at level, and we want to look at the obesity. Then after that, we're going to challenge you, and you're going to tell me what is the best diet. What is the best diet? What is the best diet? And I want you with your captain to work on giving you your rationale. What kind of diet you do for yourself, what kind of diet you promote to your patients, and we're going to try to give you some science and also my personal opinion. So I'm taking some risk. Some things will not be scientifically correct, but if you have any complaint, you can send me an email. And I wanted to thank Paul, because Paul, you're doing a fantastic job. And as I said, I come to Hawaii every 25 years, so I hope to come more often. I was in Hawaii 25 years ago, and I want to thank Alexi and all the team, because Cynthia has been communicating very well with me, and it's a pleasure to meet your team, to see all your achievements, and I hope to continue to communicate and cooperate with Paul. And thank you, Paul, very much for your hospitality, your input, and all the hard work you're doing. And thank you for you to be at the edge of wellness. I think that you have the power. The power is in your hand. You can adapt it to your practice, to your way of life. But I think you have a lot of resources. Those resources are common sense strategies. It's not complicated to do a DNA test. It's not complicated to send the saliva to a lab and get some information that you will not get any other ways. So thank you very much.
And thank you, Dr. Clement, Richard. And you have to come more often, because we need to train him a little bit. Because he's speaking all the time about patient, right? Because he speaks to doctor and
clients.
Huh?
Clients.
Clients.
Yes.
Clients.
This is the French English, and still have some confusion with your clients.
I invite him because the team is pro-consciousness medicine. And the question is all the time, what can I be done that this client be at his full potential? And as I said previously, most people are now caught in the functional. They're not necessarily diagnosed. And what can you do? And probably the most important test that has to be done is that one, because it's the one that you can do something before something happens. You can work on nutrition, exercise, and specifically address, with all your tool and technology we spoke in this curriculum of quantum medicine to not only bring people at their full potential, but not let them evaluate some imbalance. So the pro-consciousness doctor is a trainer, so you don't treat, you train, you educate, you guide them in the proper nutrition. And how important was the nutrition during his conference? Very important. And what Hippocrates said, the food should be your medicine. So we're coming back to, we do the loop here. And this test in some way guide you, to build the programs, a more accurate and specific program to not only maintain health, but bring the client at his full potentiality. So thank you very much. Very important science.